Too often, we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around.
The health center is unique in that it provides a resource in Holland that makes this a better place to live. Holland is a community that cares about everybody. And the health center being located here and being accessible to people here is a very concrete way where the whole community says that.
Because we're centrally located in Holland, right on River Avenue, close to the library, close to a lot of public transportation, so they take the bus. Some do have their own transportation, some have, we see multiple family members, so there might be one car in the family. Some people walk, some people ride their bikes. Very rarely now does a patient call and cancel that we can't find some sort of transportation support for them to get in for the appointment.
Well, this is a primary care office, so we take care of all kinds of things. We take care of acute care patients, but we also provide a lot of chronic care, and our patients have high incidence of diabetes, hypertension, heart disease, high cholesterol, and those sort of things. And it's those kind of things I think that we're especially adept at serving people.
Y no hay veces cuando él va a empezar a dormir a la mesa cuando está comiendo algo. No.
I think diversity is really the sums it up, because we see just everything. You know, that's what makes it interesting. From little babies and even doing prenatal care, seeing the babies before they're born, to I saw an 87-year-old today. Many times the patients are related, and so there brings this dynamic of understanding that family behind what the patient brings to the office.
The health center is excellent at having conversations and being thoughtful about their care for people. When real life issues do influence people's health, they talk about them and help individuals work through those issues.
I feel like we have a holistic approach to our patients that come into the clinic, and personally I volunteer the reading program, so we're encouraging people to be literate and to use books. But I guess also that idea of treating everyone who comes in the door as a person of worth, and you know that they can be listened to, their story can be told.
I work with a fabulous team. I could not be happier with the group that we have here. People who really care, people who have fun doing their job, which I think just makes it better for all of us.
What makes our staff unique to the Holland Community Health Center is they have a real passion for our patients. They choose to work here. They are so gifted and talented, they could work anywhere, whether it be in healthcare or any other type of career move that they would want to make. But they have chosen to work here.
One of the things that we've noticed is the Affordable Care Act has helped many patients, but there are still many left in a gap where they can't afford that, and so there still is a need for us to be here and to continue to provide a sliding scale for uninsured, to continue to participate with all government insurances, to just basically take all comers and be able to provide them with quality care.
For anyone who's an employer in this community, people working for them, people working for their suppliers are able to get health care here, regardless of where they are in the income spectrum. And that's important to keep every business in town working as it should. It's also important, obviously, for the quality of the life of the people who live here. Everyone wants to feel good, and when you're sick, you can't. And the health center provides people overcome those basic challenges.
But I think we're also trying to provide people with tools to just function at a higher level. And I think what we do as a community health center, preventative health, relational health, enables people to function, and they may not be able to get that same kind of care if we were not here.